Hi, my name is Dr. Alyssa Arms. I'm a physical therapist and a dance medicine specialist. This video today is to help give you some resources and answer questions that I commonly see online and in discussion forums, even in Facebook groups. We're going to be talking about why to work with a professional, what types of dance medicine specialists exist and how to find them, when to work with dance medicine specialists, and ways they can help you, and other resources that may be available. First of all, why work with a professional instead of just doing a Google search or asking for help in an online forum? With a professional, you have the opportunity to get an expert evaluation. From that evaluation, we create a customized plan or program and teach you how to go through it. We can help you make connections of maybe different problem areas that are actually all related to a common root problem. And we consider safety concerns. Maybe we need to progress in a very specific order for maximum safety. Maybe it's a matter of taking a break from some things while other things are recovering and then helping you safely progress and add those back in. We can also help make the process more efficient. You can find lots of good advice from Google searches and online discussion groups and things that you can try. But I definitely recommend, if it's something that you've been dealing with for a while, if it seems like you have multiple problems that you want to address, you've been dealing with some long-standing pain or pretty intense pain, those can all be some good signs to go work with a professional if you've already tried things and you're not getting the results that you want. With Google searches and asking online, you run some potential risk just because you're getting generalized advice from somebody who maybe has done something for themselves and it worked, but it's not necessarily something that is the right choice for every person. What types of dance medicine specialists exist? There are so many different kinds of dance medicine specialists. I've listed quite a few here, but there are even more than what are on this list. We've got physicians, chiropractors, physical therapists, dietitians, so many different kinds of professionals that have dance medicine specialties. And there are more joining the lists every single day, which is an amazing thing to know. Definitely check out when you're having any sort of problem, there probably is somebody out there who offers services with the twist of knowing the dance medicine side, and it's definitely worth taking the time to try to find them. Why work with a dance medicine specialist? We understand what it's like being a dancer. We know the language, the culture, the expectations. We also understand the overall dancer experience. Most of us have been dancers ourselves. Myself, I've been a dancer since the age of 3. I've done a lot of different styles. I've performed. I danced on point. I've done competitions. I have switched styles and made modifications to the way that I'm moving and what my body needs to be able to do for those new styles. And knowing that experience for myself and my own dance injuries and my own struggles of finding people who understand dancers is really important. We don't want to be in the situation, which is all too common in the medical world, of going and seeing your physician when you have an injury and they simply say, well, stop dancing, you'll be fine. We know as dancers that we don't stop dancing. So it's better to have somebody who can safely help us through that transition and that recovery rather than just trying to go on our own and hoping that it works out okay. How do I find a dance medicine specialist? I'm going to share 3 main ways that you can find a dance medicine specialist. First of all, Google search or whatever search engine you want to use is a fantastic way to get started. What I definitely recommend is, first of all, using the word dance or dance medicine in your search, along with the type of professional that you're looking for. So for example, you might type in dance physical therapist or dance medicine physical therapist. Once you get results that pop up for people who are near you or people that you're interested in, I suggest checking out their specific website and social media pages to make sure that they are actually dance medicine specialists. I've seen some websites where they create one line on their services page that just say, we treat dancers, and that is the only evidence that they work with dancers at all. You can also check the biographies of their staff to see if any of them have dance experience or any sort of certifications, but definitely do a little bit more homework because some of them will say that they know dancers, but they don't really have fantastic experience in it. So you want some more solid proof that they have dance knowledge and dance experience. Other things would be online databases. There are several out there. These are some that I've listed simply because I'm members of each of them. There's Doctors for Dancers, iAdams, the Bridge Dance Project, and Dance-O-Medica. When you go to these sites, they may be simply a list of founding members. They're not a complete list of all of their members, but it at least gives you a place to start or ideas of what to look for. And then some of them have very robust search engines where you can put in what kind of specialist you're looking for, put in your address or zip code, and it'll help find people within a certain radius of your location. So you can definitely find some different options to look for some of these professionals. And lastly, you can find another dance medicine specialist, not even one who's maybe in your area or the specific type that you're looking for, but you can maybe ask them and see if they have a referral for you. I don't want to speak for every person out there, but I know for myself, I'm happy to help you make a connection. If you've tried these other things, you can't find somebody who can help you, I can spend a couple of minutes to see if there's someone in any of my networks who would be able to help you. When should I work with someone? So as we talk about this, we're going to be talking more from the physical aspect, maybe physical therapists, physicians, chiropractors, trainers, but there are other circumstances where you might seek out nutritionists or mindset coaches, counselors, and different professions like that. For the physical side, if you're experiencing pain or injury, of course, come see us, but particularly if your pain has been lasting for more than 1 week, if it's accompanied by loss of joint motion, swelling, numbness, or feelings of instability. If the pain wakes you up at night, if it's present at the start of activity or it gets worse with activity, or if it causes compensated movement, like you're trying to raise your leg, but the only way you can do it is by now hiking your hip because of the pain. Some other considerations, if you're frequently injured, if it seems to take a long time to recover from an injury, if you notice imbalances of strength, flexibility, balance, or control, particularly side to side or maybe upper body versus lower body. If you're dealing with hyperflexibility, because there are special concerns and considerations that we need to have there. And then if a dancer is working hard but just not making the expected progress, there may be something more that we can check out and help make recommendations for. Dance medicine specialists consider a lot of different things. We look at past medical history and general health, past injuries, past and current training habits, dance history and genres, menstrual patterns, nutritional habits, flexibility, strength, balance, and coordination, and even other things that aren't a part of this list. Other ways that we can help you besides dealing with pain or injury, we can help you improve your performance, improve balance, or get rid of dizziness. Certain specialties can do point readiness assessments for dancers. There are hypermobility specialists, especially in the world of things like Ehlers-Danlos syndrome. If you have concerns about the growth of an adolescent, maybe they're not quite growing the way that you're expecting, they're not hitting certain milestones, there may be something, for example, nutritionally that needs to be adjusted to make sure that they're growing the way that they need to be. Changes in or lack of menstrual periods, dealing with fatigue, endurance, or energy struggles, sleep disturbances, incontinence or leaking of urine with activity, whether it's dance or something else, pelvic pain, mindset, coping. Again, so many different ways that some of these different dance medicine specialists can help. So definitely seek somebody out if you're having problems with any of these things. It doesn't just have to be pain and injury. Other considerations, some professionals or services may be restricted to one state or one country because of licensing or registrations, different things like that. Other professionals or services may be available throughout the country or even worldwide. The biggest thing is just ask. So for example, I am licensed in Colorado. There are certain services that are therefore limited to only people who are in Colorado, but I have other things that are available throughout the world, no matter who you are. So if you find somebody who resonates with you that you want to work with, just ask them what options are available and they can let you know. If they're not available to help you with what you're wanting to work on, they can also help maybe refer somebody so that you can get the help that you're wanting. And then other resources that are available. A lot of dance medicine specialists know that there's not enough information out there, and people are always looking to answer their questions. So look for things like blogs, ebooks, online courses, webinars, and in-person seminars, as well as other resources. A lot of us are quite active on social media, whether it is Instagram, Facebook, TikTok, wherever. So seek us out. There's so much information out there and a lot being added every day, which is exciting. And I hope that all of this information helps you and helped answer some questions that you might have. Our goal as dance medicine specialists is to help you to continue to learn and grow. We want to help you, your dancers, and the overall dance community stay happy and healthy. If you have any questions or want to reach out to me, here's some contact information, and I look forward to seeing you out on the dance floor.